Here are 11 questions that I commonly get asked about cosmetic eyelid surgery. What is the difference between an eyelid blepharoplasty and an eyelid ptosis repair? An eyelid blepharoplasty is actually just removing the outer skin and some bulging fat and occasionally some thick muscle on the eyelid itself. That includes both the upper eyelid and the lower eyelid, and sometimes on the lower eyelid we have to shift fat around or actually fill in fat with fat grafting to fill in hollows. When we talk about ptosis, a ptosis is actually the word for droop, and the eyelid droops down, and there's an internal muscle weakness that's allowing the eyelid to droop down. In those cases, we have to tighten that internal muscle to elevate the eyelid so the aperture of the eyelid opens normally. Occasionally, we have to do both a ptosis repair and a blepharoplasty at the same time. So one does not replace the other. In fact, if you just do a blepharoplasty without fixing the ptosis, you're going to end up with less bags around your eyes, but your eyes are still going to look droopy. What is the best age to have a blepharoplasty? In most of my patients that I see, they're between the ages of 30 and 60. There are some exceptions of people in their 20s. It doesn't matter if you're a male or a female or what racial or ethnic background you have. There are many variations within every population, and some people come in earlier and some people come in later. How do I prepare for a blepharoplasty? I strongly recommend that you stop any blood thinners of any kind, which either they're over-the-counter or they're prescribed medications. That includes Advil, Motrin, vitamin E, aspirin, fish oil, omega-3 vitamins, including Ozempic and any weight-lowering drugs, which also have implications to cause problems during anesthesia. What is the difference between an upper eyelid blepharoplasty and a lower eyelid blepharoplasty? An upper eyelid blepharoplasty is typically done due to sagging of the upper eyelid skin and possibly sagging of the upper eyelid muscle, and sometimes protrusion of fat, particularly in the inner corner of the upper eyelid. The way it is performed is an incision is made along the upper eyelid crease or slightly below the crease, and a second incision above that area is performed in order to capture the redundant upper eyelid skin and underlying muscle. In addition, some of the fat in the inner corner may be removed at the same time. Now, the lower eyelid, there may be bags of fat protruding on the lower eyelid. This fat can be accessed through an incision from the inside of the lower eyelid, or sometimes an incision below the eyelashes is also performed in order to access fat in that way, and also to take a pinch of skin from the lower eyelid if there's sagging of the skin of the lower lid. But additional treatments on the lower eyelids also include moving fat around on the lower eyelid to fill in hollows. Sometimes I do fat grafting of the lower eyelid, obtained from your belly or your hip, and then transfer it to your lower eyelid. And sometimes I tighten the corner of the eyelid if there's laxity of the lower lid. And occasionally, and very frequently I should say, not occasionally, I tighten the skin on the lower eyelid using a laser or chemical peel in order to tighten some of the wrinkling of the lower lid. Is it necessary to have a brow lift at the time of upper eyelid surgery? I commonly recommend a brow lift at the time of upper eyelid surgery because the descent of the brow can have a direct impact on the upper eyelid skin. As the brow descends, it sandwiches the upper eyelid skin downward, and therefore the amount of surgery performed on the upper eyelid is directly related to where the brow position is to begin with. If you want to learn more about brow lifting, check out my brow lift video, which goes into great detail about the implications and the indications of brow lifting during eyelid surgery. What kind of anesthesia is necessary at the time of a blepharoplasty? The type of anesthesia you will have recommended at the time of a blepharoplasty is dependent upon the extent of the blepharoplasty and whether or not you're having a brow lift at the same time you're having an eyelid procedure. So if you're just having an upper eyelid blepharoplasty, that could be easily performed under local anesthesia with a mild degree of sedation that does not require IV sedation. If you have a lower blepharoplasty on the lower lid to rearrange the fat or inject fat on the lower lid, as well as a brow lift to raise the brow, then I would recommend IV sedation, which is done in twilight sleep to make you more comfortable during the procedure. How long does cosmetic eyelid surgery take? The performance of eyelid surgery depends upon if you're having upper eyelid surgery, lower eyelid surgery, and or a brow lift, and or a fat graft, and or a tightening of the lower lateral eyelids. There are many different steps that may have to be taken, and they add additional time to the procedure. In general, it takes approximately an hour and a half to 2 hours to perform eyelid surgery in a very meticulous manner. What is the recovery like following a upper eyelid blepharoplasty versus a lower eyelid blepharoplasty? An upper eyelid blepharoplasty heals very quickly. Usually within 5 to 7 days, the sutures are removed from the upper eyelid. There's very little swelling or bruising that is usually associated with this procedure if the patient has followed the preoperative advice to stop all blood thinners. Now, in regard to the lower eyelid, it depends on whether or not the patient has had any additional procedures like fat grafting done at the time of the lower eyelid fat removal. If you just have the fat removed for the bulging fat of the lower lid, it will also heal usually within 7 to 10 days. The sutures do not have to be removed from the lower eyelid. They dissolve by themselves, and you will get rapid resolution of the surgery effect on the lower lid if you use cold compresses initially and then warm compresses in 2 to 3 days following the procedure. Now, if you've had fat grafting, it adds additional time to heal because the fat grafting causes some inflammation and swelling, and that may take several weeks to resolve. And that is considered to be normal healing in terms of fat grafting. In regard to lasering or chemical peels of the lower eyelid, it all depends on the depth of the wrinkles that you have. So I like to say that the deeper the wrinkle, the deeper the treatment, the longer the recovery. And that may take several weeks. I'm talking 4 to 6 weeks until the redness and the inflammation subsides following a deep peel on the lower lid. Now, there are more superficial laser peels that will resolve within a week following that type of treatment. What are the risks of having eyelid surgery? First of all, risks during surgery always can occur no matter what kind of surgery you have. I don't care if you're having a toenail clipped or whether you're having a brain surgery, risks are certainly inherent in any surgical process. So in regard to eyelid surgery, you can have swelling, bleeding, infections, scarring, tearing, exposure of the eye, all kinds of problems like that can occur following a eyelid blepharoplasty. However, most of these risks can be mitigated based upon the experience of the surgeon. Not entirely, because sometimes things happen that are not preventable necessarily. But in most cases, if the surgeon is experienced, the chances of having these risks are very low. Now, there can be also anesthesia risks. So injecting lidocaine with epinephrine can cause your heart rate to accelerate and so forth. And so there are other systemic risks associated with surgery, not just local risks. So you have to approach any procedure with caution, and you have to be fully informed, but you have to really weigh the risk versus the reward in terms of deciding whether or not you want to have a surgical procedure. How long does a blepharoplasty result last, and do I ever need another procedure performed during my lifetime? The answer is most people who age normally only have one blepharoplasty in their lifetime, although some people do age and have a descent of their brow, which looks like they've regrown upper eyelid skin, and therefore they need additional procedures in order to tighten up their upper lid by elevating their brow. in general, a upper lid blepharoplasty will look good for at least 10 to 15 years following the procedure, and a lower eyelid blepharoplasty as well. But sometimes the patient ages more rapidly for various reasons, either health reasons, smoking, or alcohol intake. All of those things can accelerate your aging process, and therefore the results may not last as long. Who are the best surgeons to perform eyelid surgery? There are people who would argue that the best qualified surgeons are oculoplastic surgeons who have both ophthalmology and plastic surgery training to perform this procedure, because they have a more in-depth knowledge of the anatomy of the eyelid itself. However, there are excellent practitioners in facial plastic surgery, and oculoplastic surgery, and there are also people in those categories, doctors in those categories, who are not excellent at doing eyelid surgery. So you really have to search out the right specialist who performs a lot of cosmetic eyelid surgery, who has an understanding of all the nuances of this procedure to get the best results. I've talked about the basic questions that many people ask. You may have some other questions that I have not addressed. Please leave them below. I'm more than happy to answer your questions. And check out my other videos on eyelids. I think you'll find them very informative.